This is the story of how too much cholesterol in the body can set up a process that spirals out of control and could cause a heart attack. Cholesterol is a useful lipid that the body needs to control digestion, make steroids, and maintain healthy cell membranes. Cholesterol is carried through the bloodstream in particles called LDL. Everyone needs cholesterol in the proper amounts. But if there is excess LDL in the bloodstream, it pushes inside the artery wall and accumulates where it doesn't belong. The body interprets this as an invasion that touches off a natural inflammatory process to try to limit the infection. Inflammatory cells are called into action, literally swallowing the invading LDL until they form a lipid core inside the artery wall. Now it's crucial to keep this lipid core away from the blood because the core has a strong clotting agent. The inflammatory process sets up a protective barrier by forming a cap made of a tough fibrous matrix, and for the time being at least, the fibrous cap is strong enough to keep the plaque separate from the blood. But eventually the inflammation breaks down and weakens the fibrous cap that was the last line of defense between the clot-causing lipid core and the circulating blood. This lesion has now reached its most dangerous state. And in this vulnerable state, the plaque is an accident waiting to happen. Any one of the many typical daily stressors that are normally harmless could be the last straw for a vulnerable plaque, triggering a rupture in the cap. With a cap rupture, there's nothing left to prevent the mixing of the plaque's clotting agent with the blood. The likely result is a clot in the artery. Now, the extent of clot formation and the damage it may cause could range from minor to fatal. The most unfortunate ending of that vulnerable plaque story would be a large occlusive thrombus that causes the heart muscle tissue to die from lack of oxygen. If too much tissue dies, the entire heart can stop working, suddenly killing the patient.